Hi, my name is Megan Bowman. My presentation is on the LGBTQ community. Okay, get started. Okay, so I'm not going to read every single little thing. You can pause for a second, read through. I just don't have enough time to just read through every single thing. So this slide just kind of basically saying that representation in the media for this population, it's actually been pretty helpful to advance LGBTQ rights. And it's been good for that. It's also kind of been bad because, you know, there are some TV shows and movies that have portrayed this population as being like the villains or being the ones that have mental problems or physical problems, whatever it may be, and that can just kind of shed a negative light on that population. Luckily, though, more recently, the representation has been a lot better, a little more overall encompassing, and more in a positive light. So family support. So it's been shown that having that family support and acceptance actually is correlated with good health outcomes, good mental health, lowered risk of engaging in risky behavior, and then families that reject or don't show that support to their LGBTQ family member have been shown to kind of struggle a little bit more with, mental health, substance abuse, that kind of a thing. So when it comes to peer support, it's a lot the same of the family support. What's great, though, is that peer support can actually help moderate that link between negative family relationships and anxiety. So if they're not having that family support at home and their peers are showing that support to them, that can help kind of moderate that a little bit. Unfortunately, not all peers are super supportive. We have bullies that are, picking on this population and may not aren't showing that support that they need. 1 in 4 LGBTQ people, not even just youth, but all around people, they report that they face discrimination against their peers. With vulnerability, obviously this population, with all of our populations in this class, it's a vulnerable population. Why this population is a little more vulnerable, a lot of it's due to prejudice, discrimination. They're more likely to experience violent victimization, unfortunately. But a lot of it is because of that discrimination or prejudice that they face. So with the political system, there are some policies and laws that are helpful for this population and some that are just, they may hinder this population a little bit. So the first one right here, the Title IX Act, it bans discrimination on the basis of sex and protects the LGBTQ students. And then also now we have same-sex marriage is legal in all 50 states now. And then some laws or policies that can hinder this population. Utah still allows discrimination based on sexual orientation or identity for public accommodations. So in the public, not necessarily with like housing or anything like that, but it's more like in the public setting. So some cultural factors that with this population is I focus a little bit on religion because that's kind of the main thing I think with this population. Religious beliefs can make LGBTQ population vulnerable. With many Christian organizations, they have the belief that homosexuality is a sin and it should not be encouraged. And just to kind of, if you can kind of glance there, seeing how many of Americans are actually Christian, which is quite a bit. How many Utahns are Christian? Quite a bit. Narrow it down to, which is like more the predominant religion here in Utah, which is the LDS Church, Church of Jesus Christ of Latter-day Saints. And then kind of what that church believes, since that is the more dominant church here. So with many religions believing that either homosexuality is a sin or acting on that, it can actually just create like a sense of lack of security for that population, and make them feel a little more vulnerable. With socioeconomic status, unfortunately, LGBTQ populations are, again, they are more vulnerable with this. They have a higher rate of poverty than heterosexual people. They have a higher proportion of there's a higher proportion of LGBTQ adults that face food insecurity than, heterosexual people. Discrimination can lead to that low socioeconomic status. Obviously, if they're being discriminated against, getting a job, getting that promotion that they need, housing, that kind of a thing. So with race/ethnicity, what's interesting is that this population is already underserved. So if you're adding racism to that problem, then they're even more vulnerable. So just a little statistics here, that 33% of LGBTQ people report that they have experienced discrimination. That 1/3 of LGBTQ population, they are actually people of color, and that they are at a significant risk of being unemployed, and that LGBTQ people of color youth are at a higher risk of slipping through the cracks of the U.S. educational system. And then obviously they just face a higher risk of discrimination because of kind of those two things, their LGBTQ and their race, unfortunately. Okay, so with religion, kind of diving a little bit more into this. So it's been shown that family and peer support, having that peer support and family support and acceptance, like I said earlier, obviously it's related to better health outcomes. So then if religion affects or decreases this family or peer support, they influence that, and it decreases, then obviously that's going to cause a decrease in health outcomes as well. So LGBTQ individuals that are associated with LGBTQ affirming religious groups, they've been shown to actually increase protective factors against depressive symptoms and increase health outcomes. So that's great. But religious groups, unfortunately, religious groups that express like a microaggression or subtle discrimination, that's going to affect this population's health in a negative way. So with gender, females, lesbians, and bisexuals, they actually experience a higher rate of intimate partner violence than heterosexual women. They have a higher rate of substance abuse, and that can be due to the stress and discrimination that they may face. And then they do experience higher rates of obesity as well than heterosexual counterparts. With males, gay and bisexuals, they are actually just as likely to face intimate partner violence as heterosexual women. Again, the substance abuse is higher for them. They also suffer more with body dysmorphia, which is interesting, and then they're at a higher risk of acquiring STIs. Okay, so geographical location. when it comes to receiving care, a lot of LGBTQ people are afraid of being discriminated against or being judged when they go to the doctor or wherever. And so a lot of them may prefer to go to a doctor provider that is a LGBTQ ally. So if they prefer to go to a doctor that is like that, they might have to travel a little farther to get the care that they want where they feel most comfortable. Telehealth and telemedicine, they can help kind of bridge that a little bit. But sometimes you have to go in person in the doctor, so that might not work all the time. What's great is that their websites, like the glma.org, they provide a directory of doctors who are listed as LGBTQ allies, so that in their area, wherever is closest to them. So that's a great resource. Okay, and so talking about biases, so with implicit versus explicit, we know that implicit biases are just those attitudes and beliefs that that are unconscious and they're just automatic. Like we don't even realize that we have that bias. We don't know. So an example of this is shown that sometimes providers unknowingly will not provide like the most optimal care as they would with a heterosexual individual or patient. So there are like trainings and educational resources for providers go out there that can help kind of reduce that implicit bias. With explicit bias, it's attitudes and beliefs that are consciously accessible and controlled. So they know what they're doing. They know why they're discriminating. An example of this are the bakers refusing to bake a cake for a gay couple's wedding. I don't know if you remember, that was in the news a few years ago, but that would be like explicit bias. An example of that. And here's my references.